Hi, I'm Rachel. I'm the infant feeding coordinator at Prince Charles Hospital, and I'm just going to talk through a few tips for positioning your baby for breastfeeding. So first of all, if your baby's been struggling with feeding, you might want to consider feeding them skin to skin. Sometimes that really helps, but definitely if they've got these little flip over baby grows, get their hands out, because breastfeeding is a full body experience for babies, and sometimes having their hands free really helps. Then get yourself comfortable, because you might be there for a while, so make sure you relax and sit back. And then we're going to think about how to position your baby. So when we think about positioning, we think of the word chin, okay, which reminds you that your baby should come to the breast chin first, which means they need to tip their head back. And then each letter in chin reminds you of a different point. So the C is for close, so your baby needs to come in really, really close to you. You can tuck them in really firmly. If they're going to be, lying on a cushion coming from a distance, that's going to be uncomfortable for both of you. The H is for head free, so we all get taught to support the head of a newborn, but if you do that, if you imagine your baby's not going to be able to tip their head right back then and open wide, and that's going to be uncomfortable too. The inline is for heads, shoulders and hips being in a straight line, so that your baby's not trying to feed over their shoulder like this. And then the N is for nose to nipple. And the nose being at the nipple level means that when your baby goes to latch on, they tip their head back and open wide. And when you see that wide gape, then you can bring your baby in firmly, bring your other arm around and relax. And this applies in any position. You can feed your baby lying back, under your arm, whatever, but remember the chin principles, because they apply in every position. And that wide mouth, that is the key to your comfort and your baby getting a good amount of milk.